tonight just to tell you where we are in our community regarding childhood obesity and how that plays out in our local schools. So one of the things that Laura told you about is this coalition, and the coalition is made up of several partners in the community, and those members have worked together over the last year and a half to come up with goals for our work group, which is the physical activity work group. What we wanted to focus on was to look at how are we doing physical activity and physical education in our public schools, and how well do we measure up to the state standard of 150 minutes per week. So we began looking at those issues in Ashland, Boyd County, Greene County. So we're here tonight to tell you a little bit about the data and what we have found out, and to enlist your support. You should have a copy of the PowerPoint that we're going to do tonight, and if you'll forward through to right here, go a couple more. There's our members, and you'll see that we have Dr. Khanna on our committee, as well as some other prominent people in our community. And if you'll go one more. What we're here to ask you tonight, or to say to you, is that we really want you to take a look at the data we're going to provide for you tonight, and to use that data in regards to making decision-making policy recommendations at your local schools, particularly at the elementary level, because we know the younger we start with kids in preschool, ginger, all the way up, the more likely we're going to have an impact. So one thing we're looking at is how can we help you by providing information and data to make some decisions. Secondly, do you all have a coordinated school health policy and committee at your schools or at your district level? If you don't, we're encouraging you to do so and to use those folks to help you make decisions in regards to how are we implementing physical education in our classrooms? How are we making sure that we're ensuring that 150 minutes a week of physical activity? So some rigorous planning. And how can we improve the capacity of each school, be it through physical education planning, whether it be for PD, for your faculty and staff, whether it be how to engage your parents in helping you, how do you involve your cafeterias and your food service programs? How do you do all of this and keep folks engaged and up to speed as to where they should be? So we're here to suggest that you take a real good look at where you are already with each individual school's policy. And we know that policy is made at the school level, but we also know that a Board of Education is instrumental in encouraging and supporting those policy decisions. So we want to make sure that you're taking a real good look at where you are with that 150 minutes of physical activity. And one of the things that we're running into, and you all can ask questions at the point when we have that, one of the things that we've been running into across all schools, each county, is the idea that we still are using disciplinary actions to take recess away from kids when we know that they still need physical activity. But a lot of our teachers and a lot of our administrators say, Jerry, it's about the last thing we've got that we can hang on to as a disciplinary action. We want to encourage you to take a look at that. How can we move away from that? Can we at least make some of those 150 minutes active, they're moving, they're physical, and that we're not taking it away as a disciplinary action? Okay. How do we promote high-quality health education and physical education? We all know that when we are in budget crunches, one of the first things that may be considered to go is PE teachers. We're here to encourage you to keep them around. We feel like we need them, and we feel like our kids need them. sure that you're providing ample opportunities for kids to be physical, whether it be through recess, through PE, through activities in the classroom. A lot of teachers today are incorporating curricula that don't take a lot of time and can be instructional, like the Take 10 program. Many of you may have heard of that, when you can actually do jumping jacks while you're still doing your times table. So trying to help give you information that you can use to find out what resources are available and how can you incorporate these in planning your physical activity, physical education programs. This part is going to tell you why we feel it's so important for you to consider having rigorous and strong PE, physical activity policies and programs. Jennifer, or Patty, I guess you're doing this part. Thank you all.
Hi, and I'll just echo their sentiments and thanking you for your time tonight. This is the first board meeting I've had the opportunity to attend with this group. So I'm not sure if I'm supposed to pause here and tell you a bit about myself, but I feel like what I do is so important to the childhood obesity epidemic that I want to share a little bit about where I'm from. I work for the Alliance for a Healthier Generation, which was founded by the American Heart Association and the William J. Clinton Foundation. It was a $28 million grant. So that just tells you that's one aspect of, trying to address what truly is an epidemic. But I'm here tonight to tell you about, why it's important to you. I supervise people in 11 states, mostly in the Northeast, one in Arizona and one in Kansas. And I can tell you they work with over 1,500 schools, but what they see there is similar to what we see here. The things that we're asking, we know schools across the nation, they're all, challenged by the amount of time when we ask for additional physical activity, serving healthy food. But this representation gives you an idea. It starts with 2000. I've seen this used in a number of presentations because of its impact. So I'm going to let her just kind of go through the slides, pausing after each one. So just go ahead and click the next slide. So this is in the obesity trends among U.S. adults in 2000. This is what 2000 will look like. And as you can see, with each slide, more and more of the map becomes color with the darker areas. And we'll pause, I think, right, okay. So let's go back one slide. So you can see where we started in 2000 that it was a very lightly shaded map. In just even 9 years, you can see how the map has changed colors. The obesity rates, truly, this is an epidemic. And as you can see, Kentucky is 25 to 29, in the 25 to 29 percentile. 1 in 3 kids now is considered obese nationally. If you look at Kentucky statistics, it's the same. 1 in 3 children are considered overweight or obese. So we're going to take it one step further, and I'm going to let Jennifer really bring it down to your school district and your community.
Thanks for having us. I'm Jennifer Burgett. I work for the Ashland County Health Department. I supervise the school nurses that we have both in the Ashland School District and in your all's school district. We have a wonderful relationship with your all's district nurses, Teresa and Melinda. They're wonderful. Can't say enough about them, but just wanted to share that with you all. One more. Okay. Back in the fall of 2004, before we really even had nurses from the health department in your all's district, Teresa and Melinda helped us acquire BMI data for your all schools. Now, BMI, it's in the news all the time now, and it is received criticism. And it is not the best measure, but it's basically the only measure that we have out there that takes into consideration someone's height and their weight. What it is, it's your weight in kilograms divided by your height in meters squared. And it is a good idea. It shows a relationship between height and weight and body mass. Now, if you have have some of those really muscular folks, some of our high school students that are football players. If you have a high muscular content in your body, you will have a high BMI, so that's where it kind of plays into not being very accurate. But it's the best we have. So what I wanted to show you was, this is each school, elementary school, broken down, and the blue column was the fall of 2004. So in Canonsburg, 35% of the student population was either overweight or obese. For Catlettsburg, it was 41.4%. Ponderosa was 45.4%, and Summit was at a 34.7%. As you can see from this data, we are above the state average, which is above the national average. So we're heavy here. Our kids are heavy. So last spring, we took the same measurements, and Christy Bowen, our wonderful epidemiologist, put this into a graph for us. As you can see, other than Ponderosa, the rates went up. Ponderosa did have a drop. Can I explain that? No, I'm not sure. We could look at some more factors perhaps, but I did want to show you this. Next slide. Now, if you break it down into just obese, which means that these children weigh over the 95th percentile, okay? So they weigh heavier than 95% of a normal child for their age, okay? And it does break down into boys and girls as well, okay? So as you can see, in the fall of 2004, Summit had 21.5% of their children were obese. Not overweight, obese. Spring of 2011, Summit's children, 31.1% are obese. 1 in 3 are over the 95th percentile in weight. And I don't want to hammer at Boyd County. We've already done this at Ashland. It's just as bad. But we do want to show you these statistics. And I believe this is in the PowerPoint that is in your office materials. If you have any questions about how we basically measured height and weight, the school nurses did this. Kentucky is looking at putting BMI as a requirement like in Infinite Campus. It is not right now, but just like a vision screening or a scoliosis screening, they're looking at putting BMI as a required screening.
So why are we here tonight? One, we want to share the data with you. Two, we want to thank you for what you're already doing at your local schools and at the board level. We know that you're as concerned as we are about our children's health and well-being. And three, we want to make sure that we offer you as many resources from our work group as we can. So attached to your PowerPoint tonight, there's some materials in there about some things that you can get that don't cost you anything. Some information about where to go to get more data to help you with your decision making. Some links on how to strengthen your current policies and how to begin a coordinated school health program and a committee on your own to look at these sorts of issues. So we're here to say the work group wants to support your efforts, to praise you for what you're already doing, the good things you're doing in your schools, and the concern that you have for our youth. As we all know, most of us in this room, we're at that point in our life where our health is very important to us. And when we look at our little kindergartners and our preschoolers who already are struggling and have weight issues, and those weight issues also compound into chronic illness issues, and how many of you principals that are here tonight have a room full of kids with juvenile diabetes, with hypertension, and with other health issues that increase issues with the Board of Education when they're missing school and you're missing out on funding. So it has lots of levels of importance to us. What we would like to do, Board, what we would like to encourage you to do is to encourage each of your schools, school-based councils, and your principals to put us on an